Oral and maxillofacial surgery, which is chapter 56 in your book, is oftentimes referred to as just oral surgery. And it's going to be that specialty within dentistry that's going to involve the diagnosis and surgical treatment of diseases, any injuries that a person may have sustained, any defects which are going to affect the hard and soft tissues of both the head and neck region. And the need for oral surgery is going to be indicated for a variety of different reasons. It can be the need for oral surgery can happen as a result of severe decay that can no longer be restored, so this tooth would have to be extracted. Surgical removal of any impacted teeth, and we know that there are different types of impaction. Extraction of a non-vital tooth, as we can see in this picture here. This person, this tooth number 10 is very dark in color, which usually indicates some sort of trauma that resulted either, several years ago, recently, that caused the tooth to then die and now possibly needs to be extracted. It could be needed for pre-prosthesis surgery in order to smooth and contour that alveolar ridge. Once teeth are extracted, there's some very sharp areas, and if we're going to put some sort of an appliance in that area, a lot of times we need to make sure that that bone is pretty smooth and contoured to accommodate something fitting on top of it. It could be for the removal of teeth for orthodontic treatment. We know if people have either supernumerary teeth or crooked teeth, a lot of times what gets extracted is the first premolar on the maxillary mandibular to allow room. So as teeth are being moved, there's enough space to allow all the teeth to kind of fit in there very nicely. The removal of any root fragments. There, could have been maybe an extraction that was done and not all of the tooth had been extracted. Something to that effect. There are sometimes bone spurs that will start to work themselves out, and some might be a little bit bigger than others that actually require some sort of surgery to get removed. It could be for the removal of any cysts or tumors that may be present, like down in here. This area down here we know is not an abscess just due to the shape of it. So any removal of cysts or tumors. It can be for a biopsy. This person is having a biopsy, a punch biopsy of the lateral border of the tongue. There must have been some sort of lesion on there that the oral surgeon wanted to send off to, see what's going on in that area. Treatment of fractures of the mandible or maxilla area. So if a person may have been involved in a car accident or was maybe in a fight, domestic violence, then we want to make sure, this could, be an indication that we may need to do some facial reconstruction, which is done by the oral surgeon. Surgery to alter the size or shape of facial bones. We know that if a person has, even in a person that might have some cleft lip or cleft palate, or, person with an abnormally large or small jaw might need to have some reconstructive surgery to alter the size and shape of that. Surgery for the TMJ joint, the temporal mandibular joint, we know that can lead to a lot of issues and problems with popping and clicking, as we can see down in here. And in some patients, it's very severe and causes a lot of pain, that the need for surgery is definitely something that they need to have done in order to be able to function accordingly. Already talked about cleft lip and cleft palate repairs. Oral surgeon is going to be handling anything like that. Salivary gland surgery, as we can see here, the parotid gland is located right along here, and something, either a blockage or something had occurred on that salivary gland that required the need for surgery to have it removed. And of course, surgical implant procedures. An oral surgeon, as well as a periodontist and even a general dentist, can also place implants. Again, due to their extensive training, most people opt to maybe either go to a periodontist or an oral surgeon to have both their teeth extracted and then also an implant put in its place. So these would be all different types of procedures that would be indicated for oral surgery to occur.